disclaimer. So for those who don't want to be on a camera, feel free to turn off your cameras. It's okay. This is going to be recorded and it will be public. So in case if you don't feel comfortable, you can turn it off. A little announcement this week. We had interesting week in terms of I got this global. What was the name, Olga? What was my title? I received a award. The Global Impact
Leader. Top 25 world global leaders.
International Association of Top Professionals picked 25 leaders who created a global impact according to them, and I was one of them. Judge Janine from Fox 5, she was there, so it was just interesting list of people. My face was on Times Square. You have a picture, Olga, if you could just show. I was there, and we met with all the group of interesting people, interesting professionals from all over the world, South Africa, New Zealand, Europe. It was a very interesting event. And then we had gala at the plaza where we got all these awards, and I actually given a speech. So I did not know what to talk about, but then I realized that if everybody's going through pain and how pain actually transforms and helps us regardless of what the world is going through right now. Wars, conflicts, social unrest, whatever is going, we collectively maturing, evolving, learning, and growing out of it and coming out better as a better version of ourselves. So I said something like that. It was received very well. Just a little update and show off because Olga insisted that I had to. So here I am. And now, oh, you're showing. We see your screen now, Olga. She's trying to share her screen. That's fine, Olga, if you can't find it.
I'm proud of you. Can I
Yeah,
please have a moment?
You're showing us the folder. You're not showing
congratulations.
Oh, you don't see the picture?
No, you're just showing the folder. You have to click on the...
Are you seriously? Hold on. My apology. My bad. I was like looking. Can you see the picture?
This is,
we can see it.
Talking about it, but then show the picture. The funny part is, look at the picture. I am on a billboard. I'm pointing at it, and look in the background. Tibetan monk of all the people. It had to be Tibetan monk passing by. What are the chances? So, knowing that my previous nonprofit work was in Tibetan villages and Nepal, it's funny. I thought it was funny. So, first of all, I want to ask if you guys want to talk about any medical problems, any questions, if you have any, and if not, I can just pull something and talk about it because I had a lot of questions this week from my women, from my people. And, if that interests you, we could talk about those as well. Any questions about anything? Or maybe we would just start questions later on.
I would have a question.
Yes, Kevin, ask a question.
I've been recently getting into spirituality and I'm trying to learn to meditate. Do you have any tips or ways to better kind of fall into this state of meditation?
Sure. In order for us to meditate effectively, you need to prepare your body. Body is the vessel. What's meditation? Meditation when you get into that state when you're not supposed to. Sometimes you're not supposed to breathe, but you can breathe, but you're not supposed to think. And it's very hard. And a lot of times people say, I quit meditating because it's just not working out for me. My brain is constantly working. My mind is constantly jumping, from one place to another. And that's the reason why, because the body, the vessel is not ready. So in all the ancient traditions, whether you take the Tibetans, when you take yogics from Himalaya, from India, or anybody, they all have one in common. They prepare the body first. They say, purify my body first. That's how they call it. When they say purify, it's physically, in some cases, you have to, take a shower if you need to take a shower, especially cold shower. But they also purify the body with some kind of physical activity, some kind of physical work, yoga practice, or breath work, or jumping jacks, or something that pulls that mind on the side. And after that, you'll sit down and you do a meditation. For example, in any Kundalini yoga kriya, first you go through vigorous kriyas, which is sitting and breathing a certain way in a certain position when you just can't do this anymore, but you have to just continue breathing. And the purpose of that is to turn off your thinking mind. For someone like you at your age, I know you're active, do some kind of like breathing, let's say very easy, like a Wim Hof breathing, for example, and then go for a run and then come back, do another round of Wim Hof, and then sit down and then start meditating. So there are different ways of meditation. One meditation is when people listen to the music, and it's a guided meditation, for example. Some people listen to brainwave therapy music, which is, there's no guidance, but you listen to music that creates certain brainwave in your body. So then you will kind of go into that state quicker. But there is also meditation when you just sit and close your eyes and focus on your breathing first, and then focus your attention on one object or something. For example, you just turn on only one sense, which is your, let's say, hearing. You close your eyes and you listen to something. You can listen to the sound, you can listen to the air conditioner, you can listen to your own breath, or you can actually listen to what is happening outside. The dog is barking. You just say, okay, the dog is barking. You just notice things, or like your auditory senses are working and you're just picking those up. And while you're doing that, the rest of the system is kind of taking a little breather. That's the purpose of meditation, to take a little breather and reset your sympathetic and parasympathetic nervous system. So listening to air conditioning, which there's an interesting channel. Her name is Esther Hicks. She channels Abraham. She says, if you just sit there and listen for 15 minutes to simple things like air conditioning, like a sound, whooshing sound of air conditioning. That's all you do, 15 minutes, but do it every day. And then attention, sometimes your mind start wandering, you start thinking about other things. You just gently, don't beat yourself over the head, gently bring your attention to that sound of air conditioning again, and keep doing that. If you do that for a month, your life will be completely different. You're not going to be the same. So, and there's also meditations, like an active meditation, like in Kundalini yoga, when you sit down in a certain pose and you breathe and you gaze, and when someone looks at you, it probably look very, very passive. It's like, what the hell is this? But it happens in a very subtle way, because if you sit down and close your eyes and you gaze between your eyebrows, and then you're sitting in a certain mudra, you have your hands in a certain position, and then you have to make sure that you're breathing a certain way. For example, you're doing 4 breaths in, 4 breaths out. Meanwhile, you're looking between here, and then you're looking, make sure that you're holding this. So now we have 3 faculties, just a rough example, 3 faculties that you have to focus on. So while you're focusing on it, you're dismantling your mind. So there's a lot of ways to do it. Good question, though. Thank you.
Very informative. Thank you.
All right, and then there was a question, a lot of questions this week for some reason. I don't know what is happening, but a lot of people are asking about heavy metals and post-COVID. Not necessarily long COVID, but post-COVID, because people still getting COVID, people, not even COVID, just getting simple colds and having some complications, how to bring your faculties and bring your immune system in your body back to normal, especially if it's COVID, especially if it was like a, you know, heavier form where you experience not only heavy fever, but, you know, coming out with some complications like a cough for a month or two, or you're coming out with weird itching, the skin problems, neuropathies, so these things, and extreme fatigue, adrenal drains. So these are, you know, the most common, and we say they kind of like not serious, but at the same time, they annoying and draining symptoms. People were asking about that. And I just wanted to start with explanation of how it works, and then you will, you know, understand and draw your own conclusion, you will. So, you know, the spike protein that we have in the virus, it has this ability to constantly create response, inflammation. So any virus, any protein, when it gets into your system, your immune system, once it hears that it's something is happening, immune system sends its soldiers and say, go and attack. And then depends how big the stimulus is, which is the sound, let's say, for example, or this stimulation from this spike protein, depends how intense it is. Immune system brings lots of antibodies, lots of soldiers to attack it. And when it's doing it, if it is excessive and prolonged, in some cases, it would just mimic or even turn into autoimmune process, meaning that your own tissue being recognized by your own immune system as a foreign body. And your own immune system is attacking its own body. And it could be any tissue. It could be thyroid, it could be your kidneys, it could be your skin, it could be anything. That's why we see so many people, you know, experiencing these things. And there's like, you can't pinpoint, oh, this is COVID related and this is not COVID related, because COVID sitting in the cells, and depends what is the weaker points in your body responds to it. Okay, so what do? So understanding that it's there, you can actually diminish the response of your immune system to it. We talk about pathological immune system response, and you will just boost your faculties and pacify your aggressive immune system and detoxify your cells. How you do that? Number one, you need to make sure that you have enough of nutrients in your body to fight ammunition, so to speak. That's number one. And number two, you want to make sure that you are releasing the toxins from the cells as well. It's a very easy principle. Whether we do someone who's trying to lose weight, we have the same approach. Whether you are trying to overcome any autoimmune disease, whether you're overcoming some other problems, the principle is always the same. The cell that is storage of the information and all the processes that are happening in your cell has channels where nutrition goes in, toxins go out. So you want to make sure that this process of nutrition going in, toxins coming out, to make it very efficient. That's all. It's very simple. Of course, it's not that simple. It's complex, but the principle is simple. Toxins out, nutrition in. Which nutritions? We all talk about zinc. We all talk about vitamin C. We all talk about vitamin B complex. Yes, but first of all, we need to make sure that the cell wall is intact and working properly, because the wall has those little channels and antennas. And those antennas read what is happening outside and what's happening out inside of the cell. And that's how they communicate. And this is where the process of transporting toxins out and nutrition in happens, due to those antennas. We call them receptors. So in order for that cell to have those receptors and be functional, you have to have intact cellular system. What is that? Cholesterol. People say cholesterol is bad. Cholesterol is not bad. It's necessary for us. Your whole entire system consists of cholesterol. That's why we have different fractions of cholesterol. So we're talking about healthy cholesterol that supports that your cell wall consists of cholesterol. And then we also know that besides cholesterol, there's a vitamin D, which is also, it's something that makes cholesterol. So first you have calciferol, which is vitamin D, and from calciferol, you create cholesterol. And then from cholesterol, you create your steroidal hormones, you create cell walls, you create brain cells, you create nervous cells, and everything else. So these cells are very important, and vitamin D, that's why it's so important. And that's why we see all these studies now, especially post-COVID, people who had deficiencies in vitamin C and vitamin D had more likely to die or have complications compared to those who had normal and high vitamin D levels. And because of that, especially during COVID, this is when it started, the protocols actually in labor and delivery floor, where if someone comes pregnant, whether she's positive or negative for COVID, we would start 50,000, which is the highest level dose of vitamin D, regardless of the status, because demand on vitamin D on certain bodies, like for example, pregnant people, growing people, older people, people who battling diseases, people who live in the colder areas. So our demand on vitamin D is pretty high. So that is how, this is one way of doing this. And then, of course, after COVID, it's important to make sure that you get, there's some studies showing that red light therapy neutralizes spike protein. Certain IV therapies, like, for example, NAD, does that. Myers cocktail, high dose of vitamin C, they do that. Exosome injections, they also block spike proteins. And then, simple things like stimulating your meridians and going and having acupuncture, also very, very, very helpful, because that's what happens on the levels of meridians where all the power sits. And then you go and you put the needles there and you stimulate and you start producing those beautiful neurotransmitters where you support your, the whole entire body. Question from Aldina. Let me see. She says, you recommend vitamin A together with vitamin D for better absorption, or take D on its own? Such a beautiful question. Amazing, Aldina. So I don't know if we spoke about this, but there are fat-soluble vitamins and there is a water-soluble vitamins. So fat-soluble vitamins like D, A, D, E, K. So those vitamins, they are completely different from the group that is water-soluble. And when you take high doses of D, your body kind of robs of like other fat-soluble vitamins of your body. Meaning, as you start taking high dose of D, for some reason, other fat-soluble vitamins starts to decline. And it's recommended to take D with one of the oil-soluble vitamins, especially vitamin K2. K2 is more important, and I'll explain why. Because K2 is more deficient in foods. Vitamin A you actually can get from foods, especially if you eat animal products like liver. You can get it from there. Another very good way of getting vitamin A is from carrots. You can get that, but K2 is more important. So vitamin A is something that if you are someone who feels that if you're not getting enough these oil-soluble vitamins, then you can take extra of A. But vitamin A and vitamin E, you can take it from fish, from liver, from macadamia nuts, from Brazil nuts, So they filled with that. Barley green is really filled with vitamin A as well. Especially if someone is going to have, like if you're going to the beach, you need to have lots of vitamin A. There was a study in Germany when they showed people who had sufficient amounts of vitamin A, D, and K, they had lower rates of skin cancer compared to those with a similar exposure to sun, compared to those who were deficient in those vitamins. So I hope I explained that good. If you have any additional questions, you can ask me. But always A, D, E, K, since they're fat soluble, always take them with fat. The way I take my vitamin D and K, I take all at once. I take 1 pill a week of 50,000 units of D, and then K2, I just take all 7 of them and take them once in one setting, once a week with something fatty. My source of vitamin A, my personal source, is either eating liver, or, I get my IV therapies. We get glutathione, and we get all the other IVs where we also receive that. Or barley green, that's my favorite. Barley green is amazing source of not just vitamin A, but other enzymes, kelp, and so forth. Amazing source of nutrients, and protects you. And if you take it like a couple of days prior going on vacation, and then you go on vacation, you spend only like 20 minutes on the sun and you already have a beautiful tan without burning your skin. Yeah. So that is protection from or long COVID or complications of COVID. And then people started I don't know if it's happening now or if it's been happening. It's just I started noticing it. A lot of people are going to the dentist and removing fillings that have the metallic fillings. So look in your colon, look if you have any metallic fillings. They actually do have mercury, which is sitting there and releasing mercury and creating toxicity. So I've started seeing a lot of those people who did that. It's very pricey, I heard. I don't have any fillings with mercury, so I didn't go for it, but I know that it's between $1,500 to $3,000 to remove those fillings. And then they come for, we call it chelation process protocols, which we do in our office. There's a specific IVs that person receives. We check levels first, and that was my protocol. Always check levels. If levels are elevated, go for it. If levels are not elevated, don't. But then recently someone told me, one of the doctors told me, post-COVID things changed, and our responses to normal looking levels of mercury actually kind of like heightened, and we are more sensitive to it. So a lot of them just, regardless of the levels, just started treating and giving at least short course of chelation, ADTA, and other vitamins to cleanse your liver and kidneys from heavy metals. Heavy metals actually could be very toxic and detrimental, and they very subtle. People don't even know that they have it. They may feel tired. They may feel sometimes even feeling irritated and like almost like bipolar, but then only to find out it was just a heavy metal toxicity. So, yeah. Any other questions?
I have a question again. Is there any way to get tested for heavy metals? Like, is there a test you can?
Yeah, come to the office and we're going to do it. You just have to email, or when you make an appointment on ZocDoc, just say heavy metal toxicity testing.
Mm-hmm.
And the panel that we have, most of the insurances cover it. If you have deductible, they probably will apply to your deductibles, but if you don't, it's covered. It's covered most of the time. Don't quote me because things change, but we do it with insurance.
Okay, it's a blood test, right?
It's a blood test. Yep. Yeah. But then having the protocols and using supplementation, of course, it's not covered by insurance.
Right.
Mhm.
Okay, thank you.
Welcome. Anything else? Good. No more questions? Just remember, this is just educational. This is not medical advice, just like I told Aldina. If you have any questions, it's one-on-one, you come and see me. By the way, those Tuesday meetings that we have right now, there's some changes happening in the background. We're going to have membership, and it's going to be $25 a month, where you actually will have access to me once a week as a patient. And then we also have different types of tiers. So visit our website and see what is cooking. It's coming. It's coming in a couple of months. We're going to have it. It's going to be official. My girls are working on it. And we're going to have telehealth. We have concierge telehealth. We're working on concierge services. Unfortunately, the way the insurances are, they will cover less and less. They're already covering almost nothing, but starting from January, I heard that it will be even less. So we're trying to come up with something that it's affordable, some affordable, and some of them are pricey, of course, but everybody should get something. And don't forget to participate with our master classes that we have once a month with Angelina when we talk about cellular toxin and detox, by the way. We talk about sugar spikes and other things. Also very interesting. So there's a lot happening. Be on the lookout and participate. You're going to get more information. This is more just a question and interactive, but others are more like lecture and more informative. We're also working on the summit, which is coming soon, where we're going to bring beautiful teachers and healers and teachers and doctors and giving speeches on different topics, anything between medical and spirituality, you name it, and fitness, mental health. So that's coming too. Next week, Dr. Sandra Michael will be visiting New York. We will have event Friday. We don't know what time, but it will be also Zoom. She will be answering questions. If you have any questions about E-system, the one we have in our office. So try to bring as much information as possible for you guys. Bring other friends. It doesn't have to be, the participants don't have to be my patients. They could be coming from everywhere, because we're not giving any medical advices here. So you can bring friends if you want to. Okay.
Dr. Rustamova, I find you so interesting. Last week, you spoke about the breathing technique of coming in through the left nostril and exhaling through the right nostril. So I practiced that a little bit. It's a little challenging to go 3 minutes, and I actually try to do it where I don't even use my finger. I just mentally try to think that. Can you give last time, just a quick review on the importance
Well, first of all, there are two types. One, you breathe in through your right, and then the other type of breathing is breathing through your left first. Okay. Breathe out. So when you're breathing through your right, you're breathing in and then breathing out through your left. That is to calm down your parasympathetic nervous system.
Okay.
If you're breathing out through your left, breathing in through your left and breathing out through your right, you are stimulating your sun energy. This is moon energy. This is sun energy. So you're stimulating your sympathetic nervous system. So it depends what you are trying to achieve. If you're trying to calm yourself down, if you had a rough day or something is happening, you just have to start breathing through your right and then exhale through your left.
I was doing it during workouts.
Not during the workouts, though. This is the type of meditation that you do.
Okay, because when I
You
was
don't
thinking
do
of how to,
during physical. No, this is not to be during the physical. You know, when you do something physical, you do that, but then you can sit down and you can breathe
okay.
either before or after.
Do you have
If
any
you need to focus, if you need to have like some kind of active mind, then you do the opposite.
Mhm.
Okay.
Because I was, do you have any recommendations? So for example, if you're doing some type of aerobic activity, some type of running or something, a breath pattern, I always used to
No, there's
remember two breath.
it doesn't have to be 2. It could be 3. It depends on your lung capacity, depends on how you expanding your lungs and how much oxygen you take. But I ran marathons, and my count, and what majority of us was, you take a deep breath when you're breathing it, you go 1, 2, and then you exhale 3, 1, 2. So as long as you're doing it rhythmically, it doesn't have to be quick, it doesn't have to be fast, it doesn't have to be pacing. So again, you may need only 1 because you have larger lung capacity. Some people may need 3 steps and then breathe in. But for the long distance running, as you start practicing more, you kind of develop this capacity when you just steadily, when you get into that zone, you steadily go 2 steps in, 2 steps out, 2 steps in, 2 steps out. And it's you don't even think about it, it just happens.
So
And
what
the
about,
breath is very smooth. You're not out of breath.
so what about something too, like for example, bench pressing? Would you, when you exert, do you exhale or do you inhale during the push?
Again, it depends. It depends. Like, for example, and according to Wim Hof, you breathe, you exhale, and you do bench pressing or you do your push-ups without the breathing on the exhale. But that's according to Wim Hof. So it depends whose technique you're using. It's just when you breathe in, breathe out, breathe in, breathe out, and then exhale and start doing your presses and then push-ups, you will find yourself that you are actually more efficient and you have more stamina when you do that, because you are bringing your sympathetic down and parasympathetic in balance. Like if you typically just do like 20 push-ups, you do your Wim Hof, you exhale and try to do those push-ups, you're gonna go all the way to 50. And you would think, oh, how did that happen? And that's because you just balanced your sympathetic and parasympathetic. But there's no rules. I don't think there's rules. It depends whose technique you're using. The only rule that I know that in any exercise, it all depends because of the circulation and because of your lymphatic system. If you're turning to the left, you're inhaling, you're turning to the right, you're exhaling. And when you do that, you're working in sync with your lymphatic system and your circulation. This exercise. If you're extending your body, you inhale, you flexing your body, you exhale. Same way, you're inhaling, you're opening up your chest, you're closing your chest. You're working with the physical vessel.
Yeah, so some, like I imagine a pole going from the top of my head to the top of the universe all the way down through and try to, turn and keep that fulcrum constant and breathe and do different exercises and breathing techniques to just the relaxation to get the best out of the exercises.
Anything else? All of a sudden, I'm like a coach.
I need a coach. Coach.
All right, so I'm no coach. I just share how I do it. All right, guys, thank you for coming. The recording will be on the YouTube. Share the YouTube with other people. Spread the light. We'll see you next week. Bye. Thank you.
Thank you. Bye.
Thank
Thanks.
you. Bye.
Thank you. Bye bye.